Hi, everyone. If you are joining us for the webinar today, it is right at noon, and I'm going to give everybody just a couple of minutes to join on before we get started, but I wanted to kind of get everything turned on and ready to go. So also keep in mind that there's a little sticky at the top of our chat box that you might see, and that's just telling you that if you have any questions or you want to put something in the chat box, please do, because I would love to answer questions while we go on with the webinar. I am so much more comfortable in front of a live audience. This is just weird for me. So I would love a little chatting if you have something. So hi, Tanya. She said hi. And I appreciate that, because it's kind of like I feel like I'm here all in my office all alone, and you all are just out there and I can't see you. So, but I do want to give everybody just another minute or so to get online so we can all start together. But think about what might be those specific questions that you have, and then make sure you just ask them when the time comes. Also, this would be a fun thing to write down. If you do have a wearable, write down maybe in the chat which one you have. That would be fun for me to know. It's not going to be a specific thing today in terms of, okay, Apple does this, Whoop does this, Aura does this. It's going to be a little bit more general than that, but I think I find it interesting to find out what all the things are that everybody has. So if you feel like writing that down, you can. And if you don't have one, then great. Don't worry about it. You don't need one. But they are helpful, and we will talk about that. So thank you. Thanks for your input. I like it. I think that when you do have a wearable, it can be motivating, and it will tell us some really good information. And obviously, that was kind of the basis for what I wanted to do. Plus, it did give me a little bit of, I don't know, cardiovascular health, I feel like has been around forever. And so I was kind of like, ooh, how do we do like a fun new take on this? And that's why I came up with the wearable. So there you go. Well, it's a couple minutes after, so we'll get started. And when people come in, they can kind of join. My name is Dr. Kris Wallace. I'm one of the physicians at Desert Wellness Center. And all of us here at Desert Wellness Center are naturopathic physicians, which makes us a little bit different, and I think it makes us better, but that's to be said for whoever is listening in. But what we like to do is we look at the person as a whole, and all of your parts and everything that's going on in your body makes up who you are. The heart interacts obviously with everything, but so does your thyroid, so does your hormones, so does your lungs, and we're one person, right? We're all one circulatory system. The heart has, notoriously been an area of people, a lot of attention, as it well should be. And I think that it loses its sex appeal, if you will, and especially in my practice, to hormones, because that is something that we look at every day with almost everybody that walks in my office. But I will tell you that the heart will suffer significantly without those hormones being balanced. And guess what? Your hormones will not do as well. Nothing will do as well without having a healthy heart. So let's move forward and see what there is to learn today. So for today, we are going to talk about the metrics that are involved in your heart health, why women specifically need to pay closer attention. But if you're a guy and you're on the webinar, don't worry, I'm still going to talk about you. Understanding your cholesterol, your lipids, what does that matter? And is it as important as everybody says it is? And what are some of the things that we can definitely do to make your heart healthier? And I will say that I entered into health education and the preventative medicine world mostly with a cardiovascular slant. Like, honestly, those of you that know me know that I've been going at this for many, many years at this point. Late 80s, it would have been when I started in health education. And I would say that heart health I know that's weird to say, but more popular, more common, things people talked about it more than they do now. And so it's been a focus of mine for a very long time. And I think that needs to be a focus of everybody's. In fact, specifically, women over the age of 45 across any racial or ethnic group, it is the leading cause of death for men and women over the age of 45. And however, it is the most preventable of the 5 leading causes of death. So, 80% of what we do will affect our heart health. That's a big shout out to prevention. And of course, that's something I love the most. Now, what's going on with the wearables? And I think that's important. And I see we have Apple Watch, a lot of Apple Watches, Fitbit, Whoop. So these are all going to be, nobody's written down they have an Oura Ring yet, which is my favorite right now, but of course I have an Apple Watch as well because everybody does. My husband wears a Whoop. So they're all very helpful, and because they're giving us some information, and we're going to talk about that today. One of the first important parameters that we talk about is HRV, which is people are so complicated. Oh, yay, thanks. Nora has an Oura Watch or an Oura Ring. What is HRV? And I think that's complicated. People are always like, what is that? The cardiovascular age versus the chronological age, and then what are some other key things? So let's break that down a little bit. Heart rate variability. Why does this matter? And what is it? So all of the wearables do measure your HRV, and HRV is the distance between your heartbeats. And so all of these wearables will show you a picture of that, and then it gives you a score. And your score might be anywhere from a low score might be somewhere 16 to 19 to 20, and you may be up as high as 60, 70. I will say if it's stopped tracking your HRV, somebody said they're stopped tracking their HRV, that's a bummer, because HRV is very interesting as well. It tells us how well our heart acclimates to basically stressors throughout the day. Stressors throughout the day can be everything from good stressors, exercise, excitement, to more negative stressors, workload, kids, life. Your body has to be able to acclimate to a very high moment and then back down, and a very high moment, back down. You need to be able to basically recover. Back in the day, we used to measure recovery rate with exercise. And the better your recovery rate, the better fitness level you were at, the stronger your heart was. That's kind of what HRV is. HRV means that you can switch between a stressful moment and come back down to a resting space faster. And that's important because we have these micro stressors throughout our day. It's up, it's down, it's up, it's down. You know what your life is like. And if your heart can recover from those moments in time, it is going to be healthier in the long run. Equate it to something like holding 10-pound weights in your outstretched arms. And just do that for 2 minutes. That's going to be hard. And then give yourself just a 15-second break and then go right back out and have to do it again. That's what your heart does every day. So if we did a lot of work on our upper body and we got very strong muscles, we would be better at holding our arms outstretched, right? And we would be able to hold our arms out longer for lesser break. That's kind of like an analogy of using skeletal muscle. But your heart's a muscle, and it needs to be trained to take these breaks and come back down from a high level quicker. So that's what HRV is. And HRV is highly susceptible to your lifestyle habits. And those of you that track it will see that. You'll see that things like a stressful day or less exercise, or even something as simple as drinking alcohol the night before you go to sleep, your HRV changes. Just like that, your heart, that distance between those consecutive heart rates change. So watching and monitoring your heart HRV, you want your HRV to be higher. That is what you want. So this is a great way to monitor your health. And I will tell you, wearing an Apple Watch and a different device like an Oura Ring, they're different. The HRVs are definitely different. So just use one device in this case. Don't go back and forth. Use one to measure your HRV because it will measure different amounts. It will measure it differently. Your cardiovascular age versus your chronological age, several of the devices also look at this. I mean, I think it's kind of obvious. You obviously want your heart to be younger than you are because your heart, again, is a muscle. You want it to be strong. You don't want it to have any any breaks in the microvascularity. You want it to have a lot of collateral circulation, so a lot of extra blood vessels crossing to be as a backup in case you get something where one of your blood vessels gets clogged or blocked. So you obviously want a heart that's nice and strong, like a teenager, than somebody that might be in their 50s. So anytime we are in a good training space and we are taking care of our heart, that device is going to pull that heart, that cardiovascular age down, and we want it to be lower. Obviously, we want that heart to be stronger. And it should adjust as you move through your routines. Things that affect cardiovascular age, especially in your wearable, are going to be the things that we're going to talk about in just a moment. So, as I mentioned, you might be 50 years old chronologically, but if you have high blood pressure, if you have higher lipids, if you're smoking, if you're not exercising, your cardiovascular age might be higher than your chronological age. And again, we don't want that. Lower cardiovascular age means a healthier heart and better outcomes for you. So what else is going on in the trackers? What else are we looking at, and what do they matter? So here's some other things that all of these trackers, or all the devices that you had mentioned to me, will measure. Your resting heart rate. It is so important that your heart doesn't have to beat so many times in a minute so that your resting heart rate is lower. Why? Well, I mean, just think about it. Again, the heart is a muscle. If it's stronger, it will get more blood to your body and throughout your circulation with less beats. Therefore, you doesn't have to beat as much, and it won't get as tired, if you will, right? So if you have a resting heart rate of, let's say, 65 versus a resting heart rate of 95, oh my gosh, that's a 40 beat difference. So you've got a significant difference in how much your heart just worked in the last minute than the person that had a different heart rate. So you want your resting heart rate to be lower so that really it just doesn't have to beat as much and it doesn't get as tired. I mean, that's like simplifying it as good as we can. The resting heart rate lowers when it's healthier, when the heart is stronger, and when you've trained it through cardiovascular activity. And how do you train that? VO2 max is a good demonstration of that. VO2 max is the amount of oxygen that you can take up in a breath. So your big breath that you can get in one big breath, and the more oxygen you can take in your breath, the bigger your volume is, the healthier your body is. And again, that increases with cardiovascular exercise. Exercise that will increase your heart rate to the point where, for instance, if you're walking, you can carry on a conversation, but you can't sing. That is such an old thing that we've said for over the years, but it's true. When you're walking for exercise, which many of you do, and many of my patients do, and I do, when you're walking, you have to walk with intention. Like your heart rate has to elevate up to 130, 140 beats per minute. Nothing higher than that's necessary, but it does have to elevate to that level because it's exercising. And when it exercises, just like the bicep muscles, when we lift weights with the bicep muscles, the bicep gets stronger. When you use cardiovascular exercise in your life, your heart gets stronger, takes less beats to get your circulation going, and the lungs now can take in more oxygen. Your blood pressure will also lower. If your blood pressure is lower, you will now have less stress on the blood vessels. Less stress on your blood vessels tells your body you don't need as much cholesterol or lipids, because lipids, it fixes your blood vessels. So that helps to keep the lipids lower. Blood pressure will lower if your heart is sending enough blood into the system like it needs to, because the heart is strong. The pressures inside of your body are just like the pressure inside of a hose. Think about it, a garden hose, if you have it on but you bend it so it's tight, now the pressures build up in the hose. How long is that hose going to last? Not very long. So we need your blood vessels to be relaxed so that the pressure inside the blood vessel is less, and then they don't get so tired. Speaking of being tired, what's the deal with sleep? So sleep, we talk about sleep. I talk about sleep every single day in my practice, and sleep is being tracked every single day on your device. And I'll answer that question that you have, Nora, in just one second, because I think that's a good question. Every single day on your device, your sleep is being tracked. Why? Because we want to know how long you're sleeping, but we want to know what stages, how long you're spending in each stage of sleep. Why? Because deep sleep is the most restorative sleep you will have. And for most individuals, you should be spending at least an hour and 15 minutes to an hour and a half. If you can get to 2 hours of deep sleep, that's like, you get a medal. But when you're in deep sleep, think of it as taking your brain through a car wash. You're washing everything out. All the bad cells or the used up cells are being flushed out. Your cells are being regenerated. Your body is healing. And the oxidative stress is decreasing. Sleep is the most revitalizing thing you can do for your heart, for your entire body. Now, when you talk about, I have a question, what's better or more accurate for tracking, the Apple Watch or the Oura Ring? That's like a loaded question, because I do think the Apple Watch or Garmin or Whoop, even Fitbit, it might be better for a cardiovascular fitness. It might be better for tracking your exercise. And I mean, Whoop takes things really, really farther in looking at some of the recovery and things like that. But the Oura Ring, it does track that, but the Oura Ring is the number one when it comes to sleep tracking. It also is very important when it comes to tracking menstrual cycles. So if you're a menstruating female, it will track your temperature. It marries up with other apps like Natural Cycles. When you do an update on the Oura Ring, it tells you several other apps it matches up with. It'll also match up with some food trackers now. So you can go on some of the apps that track your meals. You can take a picture of your meal and it will tell you the nutritional value of it. I'm like, what? That's super cool. So that's the Oura Ring. So it really depends on what your priorities are. Like I said, I had both, but I've been wearing my Oura Ring a little bit more because I feel like I'm getting what I need cardiovascularly from my Oura Ring. So that'll come up again. So let's talk about heart disease, and especially for women. This is kind of this is one of my favorite areas, mostly because I treat a lot of women in my practice. And one of the most important things for us as we age is our hormones, especially estrogen, as it relates to our cardiovascular health. But think about this. Heart disease is the number one killer, more than cancers combined, for women, especially over the age of 50. It's heart disease. It's not cancer. So first of all, somebody that replaces hormones in women every day. This is obviously important to me, because if we don't take care of our heart and our hormones, that is going to be, honestly, the death of us before any of the cancers. Not that cancer isn't important to talk about and deal with and prevent, but obviously heart disease is a bigger piece. Also, not that cancer is not preventable, but heart disease is more preventable than the cancer. Most cancers are. So the symptoms in women, we disagree. We don't pay attention. Shortness of breath, fatigue. Who's not tired? Okay, we're all tired. Nausea, vomiting, excessive sweating. as a gender, I think a lot of us try to ignore all those things. Like we just go through life like, oh, whatever. I'm tired. I'm just tired, and I'm sweaty because maybe I'm menopausal. I don't know, but these are really important things to pay attention to. They're not normal. So if you find yourself in a place where you have shortness of breath and fatigue and nausea, vomiting, this is something that needs to be paid attention to. Palpitations too. Oh, you have heart palpitations. It's probably just anxiety. Maybe not. Maybe we should look a little further into that, especially if you're perimenopausal or menopausal. It is super important for you to think about regular screening. Everybody over 60 needs to have been seen by a cardiologist. Why? Because it's preventative. Why not? Let's just look inside. Let's take a look at it. If we haven't looked at and done some of the testing that's available to us, it's time to do that. We will look at your labs and we'll talk about that. But it's important that you know that's the number one killer over the age of 50. So you become your own best health advocate. Let's talk about the hormones. Estrogen keeps your blood vessels flexible. You have estrogen receptors in every cell of your body. Super important, females. But estrogen receptors in your blood vessels keeps those blood vessels supple and flexible. Remember I talked about blood pressure and how if you have high blood pressure is really high, the blood vessels walls get very tight. Well, guess what happens? As your estrogen depletes in your body, now those blood vessel walls become less flexible and your blood pressure increases because those blood vessel walls are not opening and closing as well as they used to. The blood pressure increases. This puts more pressure on your heart. And as you have more pressure on your heart, because there's too much, it's trying to push blood. Imagine your heart is trying to pump blood through this very tight space because there's a lot of pressure on the walls. So now your heart's working too hard and your resting heart rate's going up. And all the things we just talked about are happening. But why? Because you're estrogen depleted. So guess what? All we have to do is replace your estrogen and all these things start to improve. We don't need to give you blood pressure medication, although there's nothing wrong with that if it's needed. We don't need to give you lipid lowering medication. Again, not a problem in the end if we need it, but you need estrogen. We are also susceptible as women when we're pregnant, preeclampsia, which increases our blood pressure, diabetes increases our injury to our blood vessels, which increases our lipids and then our heart disease risk, and even autoimmune diseases and autoimmune disorders like hypothyroidism can increase our heart risk or our cardiovascular risk. Let's talk about lipids because lipids are the thing that when you go in to get looked at for cardiovascular health, it's the first thing that we're going to look at, right? So we're going to look at HDL, LDL, triglycerides. We're going to look at particle sizes, and we're going to be doing some advanced testing if necessary. So let's talk about that. Most people know HDL and LDL and triglycerides because this is a total cholesterol, because this is the kind of standard thing that people will look at, or physicians will look at. HDL definitely is it is a high density lipoprotein. It means that and I always used to get confused about this, even when I was a health educator. And then even, when you think about it, you think high density, that's bad, right? Something's really dense. That might not be good, but it is good. The low density guys are the ones that are a problem. So here's what you can think about. Think about low density lipoproteins as being like cotton balls. Like they're low density, but then they're fluffy and they're big. And there can be, the more of them there are, they're bouncing around in your blood vessels and they can they get stuck together easily. And when they get stuck together easily, they can also snag on something in a blood vessel. And when I mean snagging on something in a blood vessel, I mean snagging on a part of the blood vessel that's been injured. And blood vessels get injured for reasons like high blood sugar, illness, or other forms of other reasons that you get an injury to a blood vessel. Your HDL and your lipids are actually trying to save you. So sometimes having an LDL that's slightly elevated is only because you were sick. You'd had a virus or a bacterial infection, or something was going on where your body was actually trying to save you. It's trying to save you. But when it gets too high and it tries to save you, it's really trying to save you. We need to figure out, why is it trying to save you? It might be trying to save you because you don't have enough estrogen. Because guess what? LDL will go up when we don't have enough estrogen, because now the blood vessels are being injured. It'll go up if you have too much blood sugar. Guess what? Blood sugars go up in menopause because glucose dysregulation is common. It will go up if your triglycerides go up. Triglycerides, it's fat in the blood. Good example of a triglyceride is ice cream. I'm sorry, ice cream. Who doesn't love ice cream? I love it, but it's not good. It is an example of a triglyceride because it's a fat and it's a sugar together. So when we have a lot of that running around in our blood vessels, that's not good either. Damages them, and then we get buildup. So total cholesterol is kind of like not the best measurement. And I'll tell you what is a better measurement. That first listing there called ApoB is probably the best measurement of your overall LDL level of LDL in your blood. It tells you what's the weight of all those LDLs. LDLs are low density lipoproteins, all those cotton balls running around. ApoB is present in every single one of them. So it is a weird thing that, why don't we just measure ApoB? And why does sometimes insurance not cover it? Weird. Well, we don't need to go there. You all can figure that one out on your own. But we measure it. I measure it when you come in, because sometimes you won't even have very high LDLs, but then you have a high ApoB. That tells me that there's somewhere in there we've got a little too many LDLs running around, and we have too many low density lipoproteins, and we need to do something about that, and we can. The second marker is LPA. LPA is a genetic marker it is a form of cholesterol. It is a form of a lipid, but it is also genetic. It's kind of like the really, really bad boy that comes with our genes. It creates more problems. It is, thanks for laughing, Kate. See, that's the problem. When I'm only in front of a computer, you can't laugh at my jokes. I can't see you're laughing or smiling or even interacting. So if you want to send me emojis, that would be nice. I would really like that too. Anyway, Lipo-A is the baddest boy of all of them because, or not Lipo-A, yeah, Lipo-A, sorry, lipoprotein A. LPA is its little abbreviation. It's genetic. It also has more fibrin in it. It increases our clotting factors. So not only is it a problem for cholesterol lipids for your heart, it's also a problem for, or can be a high risk for strokes. You can thank your ancestors for Lipo-A. We can affect it a little bit, especially niacin. I'll talk about that in a minute. Also, nattokinase and CoQ10, those are going to come up in a minute. We can affect that. We can bring that down. This is a little pet project of mine because I happen to be blessed with an amazing father who has a high LPA. So do I. So it's something that we work on. And again, if you come up and you have a high LPA, and all your other indices are lower, all your other things are, you're a healthy person, it's not something to lose sleep over, but something that we should probably look into. HSCRP, CRP is inflammation. It's an inflammatory marker. Everybody that comes in our offices gets CRP measured. When it's elevated, it could mean that you have inflammatory markers like high ApoB, high LPA. It could be that you were sick and your body was trying to save you. It could be that you have a higher blood sugar level. Either way, it deserves attention, and we will look at that. Blood glucose or hemoglobin A1C, that's looking at your blood sugar over the last 3 months. Remember what I told you that sugar does to the insides of your blood vessels? Yeah. So anytime you have high blood sugar, you're going to get some injury to those blood vessels. And what's going to elevate to take care of you? Ding, ding, ding. That's right. Your LDLs. And I know you were saying that out loud at home. So what are we doing? What can we do? You can come in my office. We can give you lots of supplements. We'll talk about supplements. But here's what I want you to do first. What I want you to do first is look at the way that you're eating. And I know that a lot of our patients do a really good job with this. And you probably do a really good job with this. But think about a modified plant-based diet. I'm not telling you to do plant-based. I'm telling you to do modified. What does that mean? That means that most of the time you're going to be choosing things from the Mediterranean style diet, and that is fish, tons and tons of vegetables, good fats like avocados, and an avocado oil, olives and olive oil, and nuts. Plant forward means I'm going to think about my veggies first, my giant salad first, and I'm going to add even plant-based proteins like edamame or soybeans. And remember, those are going to be organic, right? Yeah, we're going to add those. I don't have a problem with soy-based protein. It's fine with me. Beans. So these are things you can add for protein. And then also, can you add other forms of fish? Yes. White breast meat chicken? Yes. So those are things that we're going to look at. What does that mean we're going to take away? Trans fats, things that oh my gosh, I feel I age myself every time I say this, but in the late 80s, I used to take people to the grocery store and teach them how to shop. And I will say the same thing still applies because I still set grocery stores up the same way. Just shop the perimeter. If you only buy what's in the perimeter of the grocery store, you're probably going to be in a good space. Heck, if you go to the grocery store for your food, you're going to be in a good place instead of eating out all the time, right? So those good fats are nuts, avocados, olives. Those are good and healthy for you. Polyunsaturated fat and saturated fats, the worst are definitely going to be your trans fats because those molecules are so hard for your body to break down. Why are fats bad for you? Do you know how fats are digested? Not only does the gallbladder help, that's important, but your liver and your gallbladder pump out, especially your liver pumps out, guess what? LDL. Lipids help your body metabolize fats. So the more fat you eat, the more lipids that are being produced. Duh. So your body's only doing what it's trying to do. It's trying to help you all the time. Your body's always trying to help you. So give it some good fuel, give it some plants, and give it some good healthy meats and healthy fats so that it doesn't have to produce more LDL. And so your liver can just relax for a second because it works really hard. Sleep, we already talked about how important that is, but let's talk about exercise. Exercise like all the time. Like get up and move. Back to your trackers. They will tell you when it's time to get up and move. Your Apple Watch will be annoying telling you it's time to move, right? But it's true that it's time to get up and move. The more you move, the better your cardiovascular health will be. Sitting is definitely the new smoking. It really is. We got everybody to stop smoking, or most people too, which is great. But now we have to get everybody off their chairs. So every hour you should be up and moving around for 10 minutes. I'm not kidding. Like if you're sitting solid, you need to be up and out of your chair for a solid. If you're down for 50, you need to be up for 10. If you're otherwise, I like to see you just moving consistently throughout the day and then still setting aside that 45 to 60 minutes for your movement, specifically exercise every day. That includes strength training, people over the age of 45 specifically, with weights that are heavy enough, and also includes movement, so cardiovascular movement, walking or biking or rowing machines. I don't care. Any of those machines will work. And stretching, all of the things. It's a combination of all of the above, but just do it. Do it every day. Every day. What are some of the supplements that we use? So niacin's probably my favorite. B3 in the form of niacin or nicotinic acid will help increase HDL. Remember HDL, the good cholesterol? That number needs to be high. It needs to be above 50. If it's not above 50, the only way you can increase it is with exercise. The only way you can increase your good cholesterol is with regular exercise and perhaps niacin, B3. And if you get it in the form of nicotinic acid, it may not cause the flushing that people can get with niacin. 500 milligrams is the minimum that we need to take when we're taking it. It increases blood flow, and it also will help convert food to energy, especially in the form of nicotinamide. So it's kind of confusing. I know I had on my social media, my favorite supplement recently is a liposomal nicotinamide ribose. Why do I like it? Because it helps make NAD. It also brings a lot of blood flow to the blood vessels and helps with skin, hair, nails. It is a form of niacin, but not the best form of niacin for your cholesterol. So, talk to your provider about what's the best form for you and what would be the best amount for you. The other thing that's important is nitric oxide. Nitric oxide is very well known in the men's health world for ED because it brings blood flow, right? So, but it's also very important in the women's health world because we rely on microvascularity in the fingertips and in the hair, in the brain, but hair in the head and the brain. Toes are little small blood vessels. Those very small blood vessels need a little extra help. Nitric oxide helps with that. And if you're not wanting to take another supplement for that, this is an easy one to get in good, yummy food like beets and pomegranates and spinach and nuts. Nitric oxide's really, really easy to get. So that's a very important thing for blood flow. Berberine. Berberine has been around forever, and it's getting a lot of attention now since the onset of the GLP-1s, which are the peptides. Yes, semaglutide, tirzepatide, upcoming ritutride, all those GLP-1s, they actually lower lipids, and they do lower blood sugars. So yes, they're good for as a lipid lowering supplementation. But if you're not appropriate for a GLP-1, if you don't want to do that, you don't need to. Berberine is actually one of the #1 supplements to help with lowering lipids and lowering sugar. Berberine comes from a plant. It's not all that easy to take. I always tell my patients it's going to work, but you have to do it right. You have to take it 3 times a day. And it's best taken about 30 minutes ahead of food. I have a question. Can you take berberine with the GLPs? I think it might be overkill, depending on your dosage of GLP. So if you're doing like micro dosing of your GLP, or just doing a very small amount every couple of weeks or every 10 days or even once a week, and you still have elevated lipids, like the LPA I was telling you about, you probably could do a berberine in conjunction with your GLP and just see what you think. If it makes a difference in your labs, then keep it on. If it doesn't, then that's overkill. And too many supplements is a pet peeve of mine. So you can try it and see if you like it, or if it works for you. Nattokinase is an enzyme that breaks down fibrin, which helps take down clotting factors and prevents clots. Remember the LPA I talked about? It causes extra inflammation and extra clotting. So if you're a person that's blessed with an amazing father like me, then nattokinase is your friend. You can take nattokinase. It is a supplement, difficult to get in foods. Same with CoQ10. So CoQ10 provides energy for the cells. It supports cholesterol, and cholesterol supports CoQ10. People that are on cholesterol lowering medications are depleted of CoQ10, and now they're depleted of the energy for their cells. So CoQ10 alone can help support cholesterol, and specifically, it can help lower LPA. So, having this genetic thing going on in your life doesn't mean it's worthless or you can't do anything about it. Nattokinase, CoQ10, there's things we can do. So you can look at those supplements. You can talk to your physician about them, what might be appropriate for you. But on your own, what do you do? Walk, breathe, drink water, sleep. These are all things that are available to us for free. Use your tracking device. I am a little bit addicted to the sleep part of the Aura Ring. I'm sorry, but I am. It's just, I have to say it happens. But it's kind of fun. It's kind of fun to watch your HRV too. It's fun to say, wow, yesterday I know I didn't drink enough water, and I know I had that cold brew in the afternoon, which is a really bad habit of mine. And did it affect my sleep? And I can see that in my health tracker. Um, or the other thing I think is super fun in the track, all of them, is they measure resilience. I love this because we didn't really talk about stress. And does stress affect your overall health, cardiovascular health? Yes, it does. Why? Because stress increases your heart rate. It increases your blood pressure. It puts pressure on your cardiovascular system, right? So the more pressure you're putting on your cardiovascular system, the harder it has to work, the more beats per minute, the harder the more wear and tear on your cardiovascular system and more wear and tear on your heart. And also, if you remember, one important thing from today's talk, and I know you're going to remember this because everybody always does, when you have more stress in your life, your body puts out cortisol, and your body has a hard time differentiating between cortisol and sugar. Think about it. You eat sugar, your heart rate increases. Your blood pressure or your stressor in your life, your cortisol increases, your heart rate increases. To your body has a hard time differentiating. To your body, it's almost the same thing. It's almost the exact same thing, cortisol and sugar. So decrease your sugar intake, also decrease your stressors, decrease your stress in your life. And how can you do that? Breathing, right? Taking a nice long deep breath in, holding it, and then allowing it to come out. If you do something 5 minutes every hour to help your cardiovascular health, maybe it's get up and walk around the office, maybe it's get up and walk around your block, maybe it's while you're walking, you're taking some nice deep breaths. All of the above are going to help with your cardiovascular health in the end. And you can monitor them on your trackers, on your apps, and on any of the devices that you're wearing. The nice thing is there's a power in consistency. It doesn't have to be perfect, but it does have to be consistent. And I do think that wearing your tracking devices or tracking devices, I think that's a funny word. I'm not going to say that anymore. It's weird. We're not tracking your tracking devices. Not that somebody's tracking you, but how about monitoring devices or wearables in general? But wearing them, it does give you the opportunity to be consistent, and don't be freaked out by it. Don't become perfectionistic. It is only an estimate. I love, and I don't know how you feel about your Whoop, those people that have the Whoops, but like my husband has a Whoop. Now, granted, you're only giving it information, right? You're telling it how much you weigh, how old you are, and it's making some estimations. It'll still measure your heart rate, your blood pressure, and all the things, and input that into the formula, which is great. But it's also making some assumptions. So like he'll do yard work or something on the weekends, and he's like, yeah, I burned 4,000 calories. I'm like, wow, good job. I'm not quite sure how accurate that is. It could be accurate, but it's, again, an estimate. He definitely burned more calories than normal, 100%. On that, you can be sure. So it is something to help you be consistent, but it is not perfect. So all in all, I think that, using your tracking devices gives you the opportunity to get to know your body better. It also gives you the opportunity to try things. Maybe you are going to try niacin. I will tell you again, in my love for liposomal nicotinamide, it increases your NAD. NAD is not something we talked about in this webinar, but every cell in your body relies on NAD, which niacin helps feed for energy. And I notice that when I am good about and consistent about taking the liposomal nicotinamide and some of those other supplements that I use, I do notice that my HRV is better. I do notice that my sleep is better. And so you can use them to reflect on some of those smaller opportunities you can take in changing your health. So I think that's probably the best thing. So Paula says she has a Whoop, and it has absolutely helped improve her recovery and sleep. I love that. I love it. I love to hear that because, for so many years, I taught group fitness since like 1988 for a million years. So we would always, okay, put your few fingers on your carotid. Okay, let's take your heart rate. And that was it. That's all we could do. Now we have so many opportunities. Paula said that her HRV is improved with 15 minutes of daily sauna use. So we didn't talk about saunas or cold plunges. That's a good question. I love an infrared sauna. I do think it stimulates the cells. If your cells are stimulated and they're being fed and nourished, your HRV is definitely going to improve, right? Because the heart's getting the recovery that it needs. It's getting the cellular power that it needs behind the cells. The cells are healthier. You've less oxidative stress. So it makes sense that would help. Oh, and somebody is listening to the webinar while in a sauna. So yay, you're my people. Thank you. This is really, really good. And yes, which niacin supplement am I taking? Somebody was asking about that. I'm going to write it down because it's on our full script. And see if I can get it to type into to everybody. Chat. Thank you. I'm going to type. Yep. So it's called liposomal. Ribose Plus. Now, I'm going to tell you something about this. The brand is Code Age. Now, here's the deal with this. This is a good one, specifically for NAD and also to help with some parts of it does make niacin, but not specifically to improve your HDL niacin. So if you're going to do that one, if you need something for that, you can do just a straight niacin. The CRT, that's the one we have at our office, which is controlled release technology, which means it's not going to make you get all hot and sweaty when you take it, with food always. The other option is nicotinic acid. So there's several forms of that. Endurance is the brand that I like on Full Script. The nicotinic acid that they have there I like too. So there is some other options out there for niacin. So it really depends on what your goals are with niacin. But I love my nicotinic, so there's that. Also in the cold plunge, nobody asked about that, but women really should not be in that freezing cold water. I know you're happy that I just told you that. Probably more like 52, not 42. And it's also really nice to you definitely need to get hot before you get into the cold plunge. Doing hot, then cold is better. So sauna or hot, then the cold for about 2 minutes. And I do not agree that cold plunges should be daily. I think 3 times a week or so would be enough. So it's at some point it becomes a stressor for your body. But the whole idea behind it is that it is stimulating cellular repair. It's stimulating your cells. So that's really good. I love doing red light therapy at home. And also, if you can get a red light sauna at home, yay, good for you. I really want one, but I don't have one. So that would be good. Anything else? What other questions do you have before we close out? Because I think I was supposed to be 30 and I'm like at 50. So that's nothing new. Plus I have to eat my lunch. Any other questions? If you will, if you know somebody that didn't get on and wanted to listen, this is going to be on our YouTube channel. And we'll also be sending out an email with a link. So for men on the cold plunge, their temperature actually can be lower. They can handle a lower temperature, but it is also important for that they still shouldn't go every day, I don't think. There's going to be differing opinions on that, but their temperature can definitely be lower, and it still is better for them to go hot to cold. Ending on cold. What about grounding mats? So grounding mats are going to release and relieve stress usually, and it can help with cellular repair. So basically, anybody that's going to get better relaxation response is going to help with your cardiovascular system. The question on the supplement recommendations to lower the ApoB. Remember, ApoB is the weight of all your LDL. So anything lowering LDLs is going to lower the ApoB. So specifically niacin, nicotinic oxide, or nitric oxide, like I just mentioned in there, the plant-based diet. But supplements would be the niacin. You can do niacin 500 milligrams. You could also do like a nicotinamide ribose if you wanted to. You could do the two. It wouldn't be overkill. But then also you can do the nattokinase and the CoQ10. Those are all going to lower the LDLs, which in turn is going to lower that ApoB. Vibration plates, can that help or hurt? I don't know that I'm that much into the vibration plates for cardiovascular health anyway. Some people really like them for to drain for lymphadenopathy, or if you have a lot of you need help with lymphatic drainage, it'll help with that for sure. So that's a good thing. It's not going to hurt anything, but I don't know that it's the best thing for the cardiovascular system in this case. Thank you for all your questions. I love it. And thank you for those of you that sent me little emojis, because I like that too. Again, we're going to send you out an email with a link. You'll be able to get all the slides, and you'll be able to get anything else from the YouTube channel. We'll also have that. One last question. So the nattokinase depends on the supplement that you're taking, and I don't have a specific one to give you right this minute. And the omega-3s, typically we're going to need about 1,500 milligrams of omega-3s. Can I say something about omega-3s? If you're taking those two for your heart health, please, we use the omega brand omega-3s here, but we have got to make sure those are clean, that those are organic, that you're not just buying them anywhere. So remember, when you're getting fish oil from a fish that's not a good, it hasn't been treated well, in other words, it's got mercury or who knows, get them from a good source when you're doing omegas, but omegas are definitely good for it. I didn't mention that as much. And the vibration plate, good for osteoporosis. Yeah, I do think that would be, because I would definitely see that would be good, and with strength training. Good for you. Good job, Paula. Okay, you guys, thank you for being here. Thank you so much for listening. I was so worried nobody really cared about their heart anymore, but you all do, and you will be healthier because of it. So ongoing on out, and I will see you all either around or at the practice, or who knows, another time. Thanks so much. Oh, I'm going to write down the omega-3 on full script. That one's the one we have in the office. Ooh. It's the orthomolecular. Ooh, you know what? That one you might need one of us to send it in for you. If you need help with that one, Tanya, just let me know. Thanks so much. We'll see y'all next time.